We're in studio today shooting the Phase 2 DVD. One of the things that comes up in Phase 2 is work on the shoulder, and particularly serratus anterior around the shoulder blade. Side lying is a really great way to access this. And I wanted to show you in side lying position how I'll typically come in and work on serratus anterior. I tend to use a very broad forearm for this. A pointy elbow often feels way too sharp. I tell people it feels like I'm being prison shanked, like between ribs. It's very unnerving. So when I use a big broad, oh, you're laughing at that?
Yes.
So I'm gonna sit in a way that feels comfortable to me. I could kneel high depending on the size of the client, but I'm gonna use a big broad forearm right along the side here at the ribs, just at the axillary border of the shoulder blade. How's that right there, Kristen?
Good.
Is it tender?
No.
Not tender, okay. Now, if I hook right here, tender at all?
No.
Still good, okay. If I shear posterior or anterior to the front?
Anterior.
Or anterior. What do you think about there?
Good.
Okay. What about a jostle? There we go. This is a really great way to access the area. It's soft and gentle to the clients. I often find that people have tension in serratus anterior, often called the boxer's muscle, because it protracts, it pulls the shoulder blade forward so you can deliver a strike. If you want to change the position of the shoulder itself, I'll often lift their arm and place it over mine. So now I have this little handle to be able to jostle and move here, right there. Up or down?
Up is fine.
Up is fine. Right there? Not too much?
No.
What about when I give you some pull here on the arm? To the posterior or to the anterior?
Posterior.
Little posterior? Right. What about jostle? There we go. This is a really effective way to be able to sit and hang out for maybe 5-10 minutes on each side. You can work the serratus along this axillary border all the way down the rib cage. Just make sure to communicate with the receiver as you go. You don't want it to feel painful, but it can feel intense. Serratus anterior will lead to a lot of shoulder problems. I think because as the shoulder blade pulls forward, it puts the shoulder joint in a different position in gravity so that they're overusing shoulder muscles to mobilize the arm.